everyone, imagine yourself working hard on a big exam. However, you failed it. Would you feel really depressed?
Yes, of course.
Sure, so would I. People would be unhappy or sad from time to time. However, generally this kind of mood would go away as time went on. But if this kind of mood lasts for 2 weeks or more, then it might be a disease called depression. What is depression? Today, let me share all about it with you. My presentation would be separated into 6 parts. To begin with, I will define what this disease is, and then is the signs that depression would appear. And the next one is the classifications. And to be continued is the factors why would people have this disease. Finally, is how can people do to cure this disease, and I'll end up my presentation with my own feedback. And let's start with the first one. What is depression? If you feel sad or unhappy for more than 2 weeks, and you stop enjoying the things that you enjoyed before. Also, you alienate your friends and your family, and you start to feel numb and empty, then that might be a sign that you are experiencing depression. But are this all the symptoms that you would get? Of course not. Let me introduce more of them for you. According to studies, there are 9 simple criteria for you to judge yourself. And let me introduce them for you in detail. The first one is that you may feel sad most of the time during the whole day. The second one is that you may lose your interest in something you were once passionate in. And depression may make you feel uneasy and lose your appetite. Or on the contrast, you may eat too much and your weight will gain. And the next one is that during almost every day, you would have trouble sleeping, or it feels like sleeping most of the time. And and your speaking and your thinking becomes slowly. It feels like that it's hard for you to keep up with the pace of the world. And the next one is that you may lose your energy and you feel tired and you have low in spirits. Another is that you feel like yourself is worthless, often a burden to others, and you have suicidal thoughts. Number 9 is that it's hard for you to concentrate, and you spend a lot of time thinking just one thing. Last but not least, you would keep thinking about death, such as images your loved one's death, or you have the plan for your own death. When one exhibits lists the first 2 features along with 5 or more criteria in the 9 criteria, and it lasts more than 2 weeks, that might be a sign that you are experiencing depression. However, these are just simple criteria for self-assessment. a clear diagnosis should be made by a doctor. Then, after we know so much about it, we can know that scientists and psychologists has also clarified different types of depression. And let's dive in and explore further. Basically, depression has been separated, has 6 types, and I would introduce everything with you. The first one, let's talk about major depression, also known as clinical depression and unipolar depression. It affects how you feel, think, and behave. And all this would lead to a variety of emotional and physical problems. Also, it might impact your day-to-day activities, and it feels as if the world is not worth living. The next one is persistent depression disorder. It's a continuous long-term form of depression. It might make you feel sad and empty. Also, you would lose your interest in daily activities, and it also makes you hard to get things done. And it will also make you have low self-esteem, and you feel like you are a failure. Also, you feel helpless. The symptoms I mentioned above may last for years, and it might interfere your schools, works, relationships, and daily activities. The other one is postpartum depression. Most new moms would experience baby blue after childbirth, and it's including mood swings, crying spells, anxiety, and difficulty sleeping. The moms with baby blues would have the symptoms in the first 2 to 3 days after delivery, and it will last up to over 2 weeks. However, if she have a more severe and long-lasting sadness, then it might be postpartum depression. Number 4 is the bipolar depression. It may cause extreme mood swings. When it swings to depressed, you may feel sad and hopeless. You would lose your interest and pleasure in the things once you loved before. But when it swings to the mania and hypomania, you may feel excited and happy. Also, you would have full of energy and unusually irritable. It will also impact your sleeping, energy, daily activities, judgment, behavior, and the way you think clearly. The next one is seasonal affective disorder, also known as SAD. This kind of disorder may appear when fall comes to winter, and it saps your energy away and makes you moody. Last but not least is the psychotic depression. This is a severe depression goes along with psychotic symptoms. It stems from the neurotransmitters imbalances, stress, or trauma. After knowing so much about depression, I'm sure that you would be curious about why would people get this disease, and let me introduce them with you. Basically, there are 4 main reasons why would people get depression. The first one is genetic inheritance, and then it's brain issues, life stress, and personality traits. Let's talk about the first one, genetic inheritance. Studies have shown that about 30% of people more likely to develop depression would have the genetic predisposition. And the second part is brain issues. In this part, I will separate it into two parts to explain. The well-known monoamine hypothesis and brain regions shrinkage. And let's start with the first one. What is monoamine hypothesis? This means that the decrease of in the levels of brain neurotransmitters, like these three. These are all chemicals that allows brain cells to communicate with each other. The next one is the decrease in brain regions, like the hippocampus, prefrontal cortex, and amygdala. They would become more active and leading to fear, anxiety, and sadness. Let me introduce the three parts of the brain. The hippocampus is where is involved in memory and learning. And prefrontal cortex is responsible for regulating emotions, decision making, and social behavior. And amygdala is where our emotions processed. With these three places, it would influence our brain problem. Also, life stress will influence too. Things like arguments, financial crisis, and unemployment would influence. And also, the stress of raising children, loneliness, and the loss of loved ones would impact too. Last but not least is the personality traits. People with pessimistic and obsessive personality would tend to look in the negative side of one thing, and therefore they would have a prone of depression. These four things are many which may makes you have the depression. And next one, we will talk about how to cure this kind of disease. Basically, there are four kinds of treatments: medication treatments, therapy, physical treatment, and improve daily habits. In addition, family members can learn the symptoms of the depression, so they can notice the patient's problem and get them treated in time. Just remember, depression is an illness instead of a way of being weak. And the last part is my own thoughts about depression. Recently, the rate of getting depression has increased. About 280 million people are getting this bad condition. Celebrities like Angelina Jolie, Billie Eilish, and Beyonce also have had this kind of pain before, showing that this disease can surely influence the world. Maybe we should, perhaps we cannot treat them with prejudice Instead, we should give them companionship, listen to them, and help them get out of the dark world. After my presentation, do you have a better understanding of depression?
Mm-hmm.
This is all what I want to share today. Thank you.